I'm Carrie Machito, nurse practitioner here at DermaTouch RN in San Antonio. I'd like to welcome you to our virtual event, When Weight Loss Changes the Face, a refined approach to volume restoration. We'll be featuring Juvederm and Radiesse today. We have some amazing event specials that will be available to those that respond to our text message that we send out over the next few days. That will be a buy two, get one free of any product of your choosing. You have until the end of June to complete injection of your package. Additionally, we'll be doing a giveaway of a 3 syringe package to one grand prize winner, as well as a TNS Advanced Plus and Skin Medica Dewy Refresh Kit. We'll be announcing winners in the next 2 to 3 days by email and phone. Please stay tuned to the end. I'll be doing a live Q&A for about 15 to 20 minutes after the presentation completes. You can submit your questions via the questions tab on your device. As we lose weight, there's a lot of volumetric changes on our face. We have changes in both the deep and superficial fat pads, which fill out the skin and lead to hollowing in through this area, as well as loss of volume back through here, and contributes largely to sagging that you see structurally. Additionally, that change in volume in the face that supports the skin has some big impacts on the skin itself. So the skin relies on stretch from the tissue underneath to get the message to continue to produce collagen. And as we see those volumetric changes associated with weight loss, there's a reduction in elasticity of the skin. You'll see drying of the skin. And so not only do you have a loss of volume in the face and sagging, but you also have a reduction in skin integrity. So the skin looks drier, more dull, it starts to thin, you get crepiness and more sagging. Hyaluronic acid fillers like Juvederm and biostimulators like Radiesse work very well in conjunction with each other. While the HA fillers provide very reliable and safe volumization that can be used for improving contours along the cheeks and jaw, the biostimulators work lovely for smoothing transitions through the entire area by adding very light natural volume through the entire region, thus providing better support, improving skin structure, and all of that. We may not inject both products at the same time. They can sometimes be injected in a single treatment, but if we're treating one area with both products, we would space them out at different sessions. Radiesse is a product consisting of calcium hydroxyapatite and carboxymethylcellulose. The calcium hydroxyapatite is a biostimulatory filler. It works by providing support to the cells that produce collagen to improve collagen production and has been shown to improve both collagen and elastin production in the skin. It can be used both directly out of the syringe for contouring along the jaw and the cheeks. It can also be diluted to be injected either hyperdilute or dilute and used for gentle volume restoration more superficially. Biostimulatory fillers and hyaluronic acid fillers can both be used for a natural volumization of the face. Sometimes they can be used in the same session, however, need to be treated in separate areas. And sometimes we may separate treatments by months or weeks, depending on what we're doing. Juvederm and Restylane are both hyaluronic acid fillers. Both products offer various different products within their lines that have different purposes and can be used for lifting or smoothing or adding gentle volume. They're both wonderful products and perform excellently. They're very well tolerated. In addition to restoring some of the volume that can be lost into specific areas, when you add that volume back in, they also support skin function and help improve collagen production. Downtime associated with treatment with either hyaluronic acid fillers like Juvederm or biostimulators like Radiesse or Sculptra is really very similar. With either treatment, you can have some bruising related to use of the cannula or needle for the treatment, or swelling related to the injection of the product and the body's reaction. And this would be considered normal. With Juvederm, you'll see immediate results as the volume is added back into the area. You see contouring during the procedure and a lift and improvement. With the biostimulators, you will see an immediate improvement with Radiesse, though some of the fluid may be reabsorbed over the course of the first 3 to 5 days afterwards. And then you can see continued improvement in the skin structure and volume over time. And then with Sculptra, you will see an initial fullness as you walk out of the office related to the fluid injected during the procedure. Most of that fullness disappears within 3 to 5 days as the body reabsorbs that fluid. And then it would take 3 to 9 months to see the effects kick in and fully reach their maximum effect. Well, thank you everyone for attending today. I hope it's been a very informative virtual event. I look forward to chatting with you further during the live Q&A that follows. You can submit any questions via the questions tab on your device. As a reminder, we'll be announcing our event winners in the coming days by email and phone call. Also, we'll be sending a text message in the next couple days to all attendees. If you would like to take advantage of the event specials, please respond to that text message and we can get you set up for a consultation or treatment. The event specials are only available for the next 2 weeks. However, you have until the end of June to complete service on your package. Again, thank you for attending today. Hey everyone, I'm glad you were able to join us. My name is Carrie Machito again, and I'm here for the live Q&A. So let's get started. I have a question regarding whether fillers ever go away. And all of the fillers that we talked about today, your body gradually breaks down over time. Hydroxyapatite is very biocompatible. It's one of the products that make up our bone, and your body breaks it down gradually as it's present. And then the hyaluronic acid fillers are broken down by an enzyme that our body makes as well. They have reported duration anywhere from 6 months to 2 years, depending on what product you're working with. The products there's probably a residual amount that's still there at that point and continues to break down gradually, but requires a little upkeep from there. And then I have another question about how long it will take to see results from Radiesse. There are both immediate results as well as a longer term result. Hold on a second. Yeah, there's immediate results that you see at the time of service, especially if it's injected direct from the syringe, 100% pure. If it's mixed with saline, you get some initial volumization, and then the collagen building process occurs over about the first 3 months after injection. I have another question about what I should avoid before and after treatment, and whether there are any skincare products I should discontinue prior to my treatment. So, avoiding alcohol can help reduce the potential for bruising. Any sort of anticoagulants or blood thinners like aspirin, if you can stop them prior to your treatment, can help reduce bruising as well. Salty foods will tend to increase swelling. So both before and after the treatment, it's a good idea to avoid salt. And then as far as skincare products go, I would certainly avoid retinols for 3 days before your treatment. But otherwise, people usually are pretty pretty good with that. There's another question about whether filler can be used in conjunction with SkinVive, and it absolutely can. SkinVive supports hydration of the dermal layer of the skin, whereas the biostimulators are working to improve collagen production in the skin. So they're actually quite compatible and work very well together. They may not be injected at the same time, however. And then there is a question about whether you are automatically entered into the drawing, and that is the case. Anybody that attended today will be entered into the drawing, and we'll be announcing the winners through email over the next several days. There's another question, which fillers last the longest? So Voluma is one of the longer lasting fillers for the cheek. It's a stiffer filler. It's not appropriate for everywhere. So it's really more about the right filler in the right area. Sometimes you'll have a product that can last longer, but may not be an optimal product for a certain region. But up in the cheeks, the Voluma can last up to 2 years. Radiesse, you can definitely get some really nice improvement as well. Usually you'll see contouring that lasts about a year. But the collagen stimulation is something that persists a little longer than that. And then I have another question about what's the best for hollow, deflated cheeks. And I think it's oftentimes a combination of approaches. So the HA fillers can help with contouring. I think the biostimulators really shine for replacing large amounts of volume. So if you're looking to kind of build up the cheekbone, I think the HA fillers and the contouring fillers are great products. But when somebody's very hollow, the biostimulators give such a nice natural revolumization. I have another question about which type of filler is safer or better to use. And again, they all have different properties. I think the HA fillers, because there is a reversal agent, they inherently are felt to be a bit safer. But that's not to say that the other products are unsafe to use. Some people can have reactions to the HA fillers. I've seen that a little bit more with those than with the biostimulators. They're usually self-limiting and fairly mild swelling, and usually resolve without a lot of intervention. They just need time. They all are very well tolerated products. And then I have another question about what the lines about treating the lines around the mouth. So it looks like we're talking about these lines here. And these lines occur related to changes in the regions of the face and ligamentous connections in through here, where as we lose support back through here and things fall in and down, the lines tend to get deeper. If you look at even babies, they have nasolabial folds. So nasolabial folds in and of themselves are not necessarily a problem. We oftentimes start with addressing the loss of volume in the cheek because that helps support and improve the nasolabial fold. When you put too much filler into this area down around the mouth, it can make the face very heavy and distort the contours of the face, ultimately making our faces a little more round or squared off. And then I have another question about if I can go into more the difference between Radiesse and Sculptra. And yeah, so Radiesse is, it's made of a product called calcium hydroxyapatite. The calcium hydroxyapatite is one of the main components of our bones. Sculptra is polyl lactic acid, or PLLA. Calcium hydroxyapatite works by providing a structure for your fibroblasts to exist on. As those fibroblasts have more support, there's more stretch on them, which begets better collagen production. With Sculptra, you're
essentially eliciting like a little bit of a foreign body reaction. It's a little different type of collagen that you see from Sculptra than with Radiesse, but they're both very comparable in terms of the amount of collagen that you see produced by them. And then there's another question about which product extends to 2 years. And really, so Voluma is a hyaluronic acid filler. And in their FDA approval, it's indicated to last up to 2 years. Sculptra, they followed those patients for about 2 years after injection, and they still saw improvement in roughly 70% of patients at the 2-year mark on that study as well. So those are both really great, longer lasting fillers. And then there's another question about whether fillers can go into the temple to fill out the face. And absolutely, Voluma has an indication for the temple and works lovely there. It can be injected deep down on the bone to help support the muscle and that tissue. And then we also inject both Sculptra and Radiesse into the temples as well for revolumization. And there's another question about how long they last for someone that works out regularly. And there's really not a specific answer to that. Some folks that exercise more might metabolize products quicker. They should still get a really nice response from as far as collagen stimulation goes, though. And we have a question about how often you see filler migrate. And I think that filler migration is kind of a hot button topic right now. I think that sometimes it can be related to over-injection of filler and the product just kind of gradually spreading. We don't really oftentimes see product travel from like here to here, right? But if someone's getting a lot of filler over an extended period of time, they get more and more puffy as time goes on with the HAs. So it's not really a common thing to see if they're treated conservatively and well managed. I have another question about if I'm doing fillers, but also want to do soft wave, whether there's an order in which those should be done and the time to space the treatments apart. And so in response to that, I think that the biostimulators really support what soft wave does because you're stimulating the body to produce more collagen. You can do them on the same day in reality. They did studies with Radiesse and an intense ultrasound therapy to stimulate collagen and found great results with that. The thought process is that in supporting that collagen production underneath the skin with the biostimulators and then with the energy-based device, you get a synergistic effect and thus a little bit greater collagen stimulation as a result. I have another question. And then as far as timing, I think the other thought I have on that is that it's a really nice thing to inject a biostimulator roughly a week or two before soft wave as well, to just prime the cells that produce collagen to be more responsive when you get your soft wave treatment. So soft wave is something that is not going to break down the biostimulatory fillers. So you can absolutely do them either the same day or spaced a little bit apart. I have another question about whether it's safe to use around the eyes and whether the results are better than Botox. And you just have to keep in mind that this is different than what Botox does. Botox works on the movement in that area, so it's directly reducing the amount of movement and thereby reducing the breakdown of the skin and the lines in that area. There are some fillers that can be beneficial around the eyes, but they don't ever reduce the movement. That's not what the fillers are meant to do. So they can soften the lines a little bit, but they're not going to be quite as effective as Botox for the crow's feet. And then what are the potential side effects? Of course, bruising, swelling immediately after the procedure is those can be pretty common things to see. Bruises usually are going to heal within 1 to 2 weeks. Swelling oftentimes goes down within a few days. Most people tolerate these products extremely well. Occasionally, you can see nodules that form with any of these products. With collagen with Radiesse and Sculptra, they're going to tend to be more of like a tight collagen nodule. It's going to take time for that to resolve. Typically, sometimes we can inject products to help speed along that process, but they're very uncommon side effects to see. And then with the HA fillers, when somebody develops a nodule, it can be broken down with Hyaluronic or hyaluronidase. And then how many treatments are required? And that varies from person to person. I would encourage you to come in for a consultation. And I have another question about whether you should be well hydrated before receiving fillers. I think you should be well hydrated for your skin in general. So yeah, absolutely. And which product encourages the body to build the most collagen and structure? And in the various studies that they've looked at, they see a pretty comparable amount of collagen production with either the Sculptra, the PLLA, or Radiesse, which is CAHA. HA fillers also promote collagen production in the skin, a little less collagen production than what you get with the biostimulators, but you see collagen production with HAs as well. And I have another question about should face tightening be done first? And that's really kind of getting back into the question about soft wave. Face tightening is relying on stimulating collagen production, and the various different treatments, they really complement what the biostimulators do. You can do it before or after. I think doing the fillers beforehand can sometimes augment the results that you get from the energy-based devices. I have another question about whether the neck can be treated with any of these, and absolutely. So the neck is an area that we would inject a more dilute version of the biostimulators. They work very nicely in that area. The HA fillers can also be used for like the necklace lines, to soften the lines in that area. There's a question about whether you can put filler in the earlobes, and the earlobes are a wonderful spot for fillers. I think the HAs work very well in that area. Can these products be used on loose skin on the neck? And yes, that's so with Radiesse and Sculptra, you can inject them in a more dilute version into the neck, and they tend to lay very well. They help improve crepiness. They're not going to give you surgical results, right? So if there's a lot of loose extra skin, that's something that's probably best treated surgically. But for a light tightening of the neck and crepiness, they work wonderfully. And then I have a question specific to weight loss. If you're still on a weight loss journey, whether it's better to wait until meeting the weight goal. And I think you can make an argument for either approach. I think with the contouring, sometimes it is nice to wait until you're closer to your final weight. But with the biostimulators, it's really nice to support the skin as you are losing weight so that you have less of that loss of elasticity as you go along. It kind of softens the blow a little bit. So, I mean, I think that is definitely something that can be done. And then there's another question about whether this is the same for loss of fat under eyes due to weight loss. And so that kind of gets into what exactly you mean is probably best answered in an individualized consultation in the office. We don't tend to inject a lot of the biostimulators up underneath the eyes because of how thin that skin is in that area. The HA fillers can be injected in that area in specific scenarios, but I would recommend coming in for a consultation. Does your skin go back to the same sagginess it had before after it wears off? So there is absolutely upkeep with these products. With Radiesse, you would typically start with a couple sessions to help improve the skin quality. And then that is something that you would probably look at repeating maybe 1 or 2 sessions a year after that. And it does, as you continue to age, the skin is going to continue to age as well. So intervention now, if you don't ever do another treatment, you'll see it progress back to where it was and then beyond. And then which fillers are better for people in their mid-50s? And are there certain fillers better for people in that age group? And as far as that goes, I think that kind of combining the properties of the different products is very beneficial. We tend to have quite a bit of volume loss in our face by the time we reach our mid-50s. The HA fillers are lovely for that contouring and providing a direct lift. And I think that the biostimulators do such a great job of just overall volumization that they also have a place. And there's a question about what about dry or steam sauna? I would say you should not do that in the first few days after treatment because of all of the inflammation. It would drive additional inflammation, but beyond that, I don't have a problem with a sauna. Is there a certain age where you would say you are too old to do something for collagen like Sculptra? Would it be successful? And I think that is a complicated question. I think when people have started with Sculptra younger, they can certainly continue to maintain a higher level of collagen production as they age. If they wait until they're, say, 80 to get their first injection of Sculptra, their results are probably not going to be as significant because they've had so much more collagen loss in that time frame. Collagen is something that we reach our peak production in our mid-20s and it starts to decline gradually after that. And so if you can catch it earlier on, it's definitely beneficial. That's not to say that you won't see some improvement. The improvements just don't tend to be as dramatic. Let's see. And there's a question about red light therapy and whether it would help the injectable treatment. And red light therapy, the thought process on that is that it should help stimulate collagen. And so I would hold off on it probably in the first 3 to 5 days after treatment, just to let your skin heal and the inflammation to go down. But then once things have healed and the swelling's down, I would say the red light definitely is something that would support just the same way that soft wave does. The biostimulatory fillers would likely enhance any benefit that you get from the red light therapy. And then I have a question about male patients and fillers to maintain a more masculine facial shape. And that is absolutely something that we take into consideration with fillers. There are lots of male patients that get treated with these products and they can have excellent outcomes as well. Right. So just a reminder of the specials. We have buy 2, get 1 free on all of our fillers for the event. So you'll be receiving a text from us. If you can text back volume, you'll be contacted for a consultation. And thank you again for attending tonight.